Thanks so much for coming today. I think it's really important and exciting to kind of talk about erectile dysfunction. A lot of men sit around and don't seek care and don't kind of try to find what's going on. And we're here to kind of give you information about erectile dysfunction and talk with you straight up about kind of the risks, benefits, what's happening and why, as well as discuss treatment options and go through all the different options. Just a little housekeeping, at the end there is going to be a Q&A session. If you have any questions whatsoever, please type those in. We are going to have all the mics for you muted so that we can kind of run through these slides, because a lot of questions are going to get both generated by these slides as well as answered by these slides. So my name is Dr. Ostrowski. Thanks so much for tuning in. I am a men's health specialist over at Evergreen Health, which is just kind of north of Bellevue. I'm one of the only men's health specialists in the state of Washington and the only person on the east side. So I'm really excited to be talking with you about men's health as well as talking about treatment options. I obviously do a wide range of men's health, but a big part of my practice is erectile dysfunction and Peyronie's disease, which is curvature of the penis. And so we're going to kind of go through all the different options, treatments, causes, and really kind of get to the nitty gritty of all these things. Just to give you a little overview of where we're going. So that was kind of an introduction about who I am, why I'm speaking, and why you should kind of see a men's health expert. We are going to have a really straightforward discussion about erectile dysfunction. What causes ED? What is erectile dysfunction? How do you kind of think about it as an indicator of maybe something else happening in your body, as well as discuss treatment options based upon kind of what's going on. We'll talk about the treatment options, discuss the advantages and disadvantages of those different treatment options. We are going to have a little video about kind of some of those discussions and options, and then go over the Q&A at the end. So what is erectile dysfunction? Obviously, I see this a lot in my practice, but erectile dysfunction is the inability to get a sustainable erection that lasts for as long as you want it to, or the inability to get an erection that is maintainable. So maybe you get an erection, but it doesn't maintain the way that you want it to, and it's not satisfactory for intercourse. It can be a number of things like we talked about. Can you get an erection but not keep it? Can you not get that erection the way you want it to? Or are the treatment options that you're trying really aren't providing the benefit that you want? And so we need to look at other options. Erectile dysfunction is a lot more common than most men think. If we just look at overall men over 50, about half of them are going to have erectile dysfunction. And then a lot of times men aren't really going to discuss this or talk about it. It's associated with a whole host of diseases that we're going to go into. And so treatment, talking about it, trying to understand the causes are all really important parts of this. They're also going to be parts of our treatment options and discussions about how to make treatments work better. A lot of men kind of associate erections and orgasm and ejaculation all together, and they are very closely related. But they're all kind of separate beings, meaning that erectile dysfunction is the ability to get that erection. Orgasm is that kind of sensation and good feeling that happens often when you ejaculate, which is when the fluid comes out. Normally, when men have better erections, it fixes and helps those issues with ejaculation and orgasm. And so we're going to kind of talk about that. There isn't a man who I haven't met who can't have their erection restored, and that's because we've got lots of great therapies and options that we're going to talk about at the end of this. The vast majority of men are going to have some sort of reason or cause for their erectile dysfunction. It's pretty unlikely, although it does happen, when men come in without any major cause of their erectile dysfunction. That can be from things like a spinal cord injury or a brain injury. It can be from high blood pressure, cardiovascular disease like a heart attack. It can be from diabetes, even if those blood sugars are well controlled. It also can be associated with surgeries, things like colon cancer surgery or prostate cancer surgery or prostate cancer radiation can all have impacts on your erections, because really it's going into kind of how your body's able to dilate those arteries and what happens with those arteries. We also know that kind of substance abuse and substance use can have impact. We all know that, having alcohol isn't going to help erections from an overall treatment standpoint. Those are things that we talk about, as well as things like, being healthy or trying to exercise more often. Those sorts of things help with erections and how you are able to get them and maintain them. Erectile dysfunction, because of what it is, it really is and can be on multiple studies seen as a marker for cardiovascular disease. And then that's because one of the main drivers of the ability for you to get an erection is the ability for those arteries to kind of dilate. The ability of those arteries to dilate is really from something called nitrous oxide, which is from your endothelial cells. And when those endothelial cells aren't able to release nitrous oxide or aren't able to kind of get the impact of that nitrous oxide and aren't able to dilate, that's what causes issues. And that inability to dilate also happens in things like cardiovascular disease, which is when you get kind of plaques in those arteries and it can cause blockages into your heart. It also happens in carotid disease for the big arteries going up to your brain that can cause things like strokes. And so we look at erectile dysfunction, both for obviously its impact on your erections, but also as potentially a very good marker of an issue with those endothelial cells and a marker for cardiovascular disease. So for men who've never had kind of a workup or evaluation and just have erectile dysfunction, we talk about kind of getting evaluated and trying to seek care to make sure your blood pressure is controlled, make sure that there are other risk factors for cardiovascular disease, and use this as kind of a tool to help us improve your overall health. When we look at risk factors for erectile dysfunction, really those risk factors are many, but the big ones are aging. All men, as they get older, those arteries don't dilate as well as they used to. So if we look at men in their 50s, right, 50% of them are going to have erectile dysfunction. When we go to 70, about 70% of men are not going to have the ability to get or maintain a good erection. There's also chronic diseases that go along with that. We talked about some of them: high blood pressure, hypertension, diabetes, cardiovascular disease, depression are all diseases that have impact on the ability for those arteries to dilate. We know that some of the medications that we use for treatments for those diseases can also have impacts on your erections. And those are things like high blood pressure medications or antihypertensives, which include thiazide diuretics and beta blockers, among other medications that can have impacts on your erections. When we look at lifestyle factors, right, lack of exercise, stress, alcohol, smoking, all have impact on those arteries and the ability for them to dilate. And so we always kind of have conversations about, how much you exercise and how can we improve your exercise, maybe a little bit of weight loss, and how can we kind of control all these other things that are going on to help improve your erections for where they're at now, and obviously help improve your life and risk factors going forward. When we kind of break it down into aging, right, the process of aging increases your risk of erectile dysfunction for a number of reasons. It increases the likelihood that you have some of those other chronic diseases, and that is just a known fact that getting high blood pressure or those sorts of things is more common as you age. There are psychological and relationship issues that can have impact. And when we look at kind of the highest causes of those issues when we go to aging, those are things like what we talked about, and that's high blood pressure, diabetes, looking at your cholesterol levels, and if those are kind of an impact or not where we want them to be, controlling those and helping control those are huge impacts on your overall quality of life going forward and likelihood of getting cardiovascular disease or heart attacks or strokes. Controlling diabetes is very important. When we look at diabetic men and their blood sugars and how well they control them, that does have impact on their erections. That being said, no matter how well you control your blood sugars, there is an impact of diabetes on your blood pressure or on your erections. And when we look at men who've had diabetes for prolonged periods of time, regardless of how well they're controlled, they are going to have issues getting or maintaining an erection, and that's also combined with the impact of aging. So controlling your diabetes is super important to kind of allow that timeline to go longer, meaning that the medications that you need may last longer, or you may go farther without needing medication, as well as when you kind of get on a therapy that works, that therapy is going to work longer if your diabetes is under better control. High blood pressure is also super important. We did talk about some of the medications that treat high blood pressure do have impact on your erections, but there are medications that don't have impact on your erections. when we look at high blood pressure and erections, there's multiple studies looking at the impacts of those can have on your vascular disease and cardiovascular health, and the impacts that those have. If we look at your kind of risk factors for erectile dysfunction, right, based upon which chronic disease you have, what you'll see is that all of these chronic diseases increase your risk of having erectile dysfunction. Diabetes is one of the worst, obviously, because of the impact that it has on the ability for those arteries to dilate. Prostate disease, mostly because of the treatment options, and those treatments have impact on your erections, and that's because the nerves that go to kind of cause your erections go around the prostate, and that can have significant impact either with surgery to kind of remove the prostate, those nerves kind of get impacted, or for radiation that has impact on those nerves as well. Whenever we see cardiac disease, heart attacks, strokes, or peripheral vascular disease, we know that there's some sort of endothelial damage or damage to those arteries and the ability for them to dilate, and so that increases your risk of erectile dysfunction. It doesn't necessarily mean that there aren't treatment options for it, but it means that your risks go up. Prostate cancer is very specific because those nerves that go around the prostate, even if you have the best surgeon, those nerves can get impacted because their goal is to treat that cancer and to do the best that they can to kind of preserve those nerves. But no matter what they do, it's not going to be as good as it was when you had your prostate there and before they had to remove it. Just to be clear, prostate cancer itself does not cause erectile dysfunction, but the treatments for it do. And those treatments most of the time come down to surgery to remove the prostate, called a prostatectomy, or radiation, which is where they're either putting little seeds into the prostate that have radiation in them, or external beam radiation to the prostate area. And that's because it has issues or damage to those arteries and the ability for those arteries to dilate over time from the radiation effects, and it can have some impacts on the nerves themselves. Smoking and medication are really common causes. So even if you quit smoking a number of years ago, the impact on those arteries is still there. And that's because those arteries become more brittle and they just don't dilate as well as they did before. It's almost a twofold increased risk with smoking of having erectile dysfunction. And there's a very clear linkage between that erectile dysfunction and the endothelial damage from that standpoint. Obviously, quitting smoking is better for your overall health. It decreases your risk of bladder cancer, lung cancer, and does help erectile dysfunction. It does help decrease your risk of erectile dysfunction, but is not as good as if you never smoked. That's just known facts. We know that medications have impacts because of the ability for your body to kind of respond to the needs of the penis and for those arteries to kind of dilate. And those most commonly are beta blockers and thiazide diuretics having impact. So a lot of guys ask in my practice kind of how does an erection occur? And these are really great questions, right? Erections really are a combination of things that we're going to talk about. Excitation, sexual stimulation, those sorts of things tell your brain to send signals down through the nerves. Those nerves go through your back, and so back surgery can have impact. Those nerves kind of go around the prostate and to those arteries, and they tell those arteries to dilate, and they tell them to dilate through that endothelium and that nitrous oxide release. And that works together to kind of keep those arteries dilated. When those arteries dilate, this massive amount of blood kind of rushes in to kind of do that stimulation. That blood basically becomes trapped in the penis itself, and that blood basically helps kind of trap and close off those veins. If we look at kind of this cross-sectional area, here's the penis itself. If you took it, and here's a penis, we kind of cut it like a hot dog and look at it from the end. That's what's over here on this side of the screen. On the outside of this is the skin. Then you've got 3 cylinders. There's kind of the urethra, which is the P tube, and then you've got 2 cylinders inside, 1 cylinder here and 1 cylinder here. In the center of those cylinders is these little blood vessels, and that's the blood vessels that are kind of controlling everything. When this area fills up, it's kind of like sponge tissue. That sponge tissue gets filled, and that's what kind of gets that erection and closes off and traps that blood in there, and it traps it in there by closing off the veins leaving. When it gets completely filled, all these little sinusoids that you see are completely filled, and that's what kind of gets you the erection, and it kind of sticks out the way we want it to. it stays there until it gets the signal to kind of, bring down the erection. And normally that signal is orgasm and ejaculation. And then your body kind of gets that signal to kind of close off those arteries and to close everything down. All right, we're going to kind of switch gears because we just talked a lot about how you get an erection, what are the causes of erectile dysfunction, and we're going to kind of switch gears and talk about treatment options for erectile dysfunction. When we look at the first line therapies is always kind of oral medications. Oral medications include things like Viagra, Cialis, Levitra. Most of the time, guys have tried some form of this by the time they've come to me, unless they can't take them. And they can't take them either because they've tried them and they have issues with side effects, or they're on like nitrite or nitrate medications and they can't kind of take those medications. The issues with the oral medications are they're still not guaranteed to get an erection. There is some kind of learning process to it, right? Of what's the right dosage for me? How does that work? And in about a third of men, it's not going to be effective in the way that they want it to be. And you got to take it about an hour and a half a half an hour to an hour ahead of time, ideally on an empty stomach. There are side effects of the medication. Most guys are going to get side effects of kind of nasal congestion, flushing of the face, headaches are the most common ones. For Cialis, they may notice a little backache. For Viagra, they may notice a little bit of blurred vision or things like that. They are sensitive to what you eat, and so doing that on an empty stomach does make them work a little bit better. They're not magic pills. They still need kind of all the same things that you need to get and maintain an erection. And for some men, this is going to work well enough. But for some men, at some point, they'll stop working. And that's kind of what we talked about, right? Exercise, healthy lifestyle, those sorts of things may prolong how long these medications work, but they're ultimately, they're only as good as those arteries are and the ability for those arteries to dilate. After the oral medications, basically, then we start talking about a little bit more invasive options. And one of those invasive options becomes an injection. And it is a needle that goes directly into the penis. The kind of advantages of this are that you can kind of give a stronger dosage so that if Viagra or Cialis isn't working, then obviously you can give a little bit higher dosage form to kind of control that erection. The disadvantages are pretty obvious, right? You got to give yourself an erection in the penis every time you want to get an erection. I've got a lot of guys coming to me who say I've got to give it to myself every time. They didn't realize that every time they've got to give themselves an injection if they want to get an erection. Obviously, it can be a little bit painful at that injection site. You can get some scar tissue formation that causes kind of curvature of the penis at that site where you do the injections. And there is kind of a learning process of what's the right dosage for me. Am I going to respond to this dosage? If you have a new partner, how's that going to work? Because there is kind of a learning process to this. And what does that look like? It is also possible to give yourself too much medication. And if you give yourself too much medication, that's what you've heard about on all the Viagra Cialis commercials, of that 4-hour erection. And those are reasons that you need to go to an emergency room. And they need to give you some medication and sometimes give you an injection into the penis to bring down that erection. That is kind of a emergency, because if you don't do that, you can get scar tissue formation and this area on the penis that you're injecting. If you aren't getting, basically the blood is trapped in there, and if you're not kind of getting that blood out, eventually that tissue will end up basically dying and forming scar tissue. And we don't want that to happen, because that will have permanent issues with your erections. Another option is a vacuum erection device. The advantages of it are that it is non-invasive. The real disadvantages are that for a lot of guys, it doesn't work very well. And that's because you have to have this kind of constrictive, you basically pull the blood into the penis itself, and then you've got a little constrictive band at the base of the penis. That constrictive band is what keeps everything in there. And obviously, if that band is loose, then the blood's not going to stay there, but often that's when it's comfortable. Or if it's tight, it isn't often comfortable, but it keeps the blood in there. And so it can be very tricky to kind of find a situation that works. It also is not very kind of spontaneous, meaning that, it requires a little bit of forethought and work to kind of get it to work in the way you want it to. It is very cost effective. And so some men like that, once they bought the vacuum erection device, then everything kind of, they have all the tools that they need to kind of get an erection. But the the issues are pretty self-explanatory from that standpoint. Okay. One of the next option is something called Muse, which is a urethral suppository. It's basically a little pellet of rice that goes into the urethra or the P tube. What that does is basically kind of dissolve into those corpora that allow you to kind of get a better erection. It is a small little applicator that goes into that P tube. You push on the little top of it. That releases that rice pellet. It dissolves on its own. The advantages of it are that it is not as invasive as like an injection. The disadvantages are that oftentimes it's very expensive because you got to buy a 6-pack, which basically is normally about $40 a pill. And so then you're talking about $250 in order to try one pill. And often it doesn't work all that great or not that much better than the oral medications. It can cause a little bit of burning with urination because it's kind of dissolving in that area. And that's the most common reason why guys kind of stop the medication. I'll be honest, it's most of the time guys don't choose this option unless they don't want to try one of the other options just because of the cost associated with trying it. Next, we're going to kind of talk about is the different implantable devices. And the first one we're going to talk about is kind of the malleable, or what we call the Genesis penile prosthesis. What it is a permanently inserted kind of bendable rod that goes into the penis itself. It is there and malleable, which is what guys like about it, meaning that they don't have to pump anything, they don't have to do anything about it. It's very easy to use, and they have kind of all the hardware that they need in order for things to work. It works very well, especially for men who've got not as great dexterity or issues with pumping, because the next device we're going to talk about is a pumpable device. It is totally concealed in the body, so no one's going to know besides you and your partner kind of that you've had it done. And it is kind of one of the lesser expensive when it comes to kind of prosthesis. The biggest disadvantage is that obviously there's no way to kind of inflate it and deflate it, so you're kind of what we'll call semi-rigid, which means that there's that malleable implant that's in there all the time. So regardless of whether you're peeing or going out to dinner, it's still kind of in that position. You're just always kind of able to use it without having to use anything like a pumpable device. Next, and what I would consider the gold standard treatment is the Titan inflatable penile prosthesis. What that is basically a 3-piece inflatable device that we're going to talk a little bit more about what each of those pieces are. When we look at it, really the reasons guys like it are pretty great, and that's easy to use. They have a implantable device that once they're done with it is a reliable, rigid erection that is spontaneous, meaning that in 30 seconds they can get a device that is fully hard, and the satisfaction rates are incredibly high. When you are in the deflated position, no one is going to be able to know that you had an implant done. And so compared to the kind of malleable device, this is a concealable option. It expands into kind of the space that your body will allow it to expand into. So from a girth and length expansion, we kind of fit those to you. And obviously when it's flaccid, it is just kind of like, it sticks out a little bit farther because you have something in there and you can feel that when it's in there. But no one's going to kind of know that you had anything done compared to before. I'm going to show you kind of a video and talk you through that from that standpoint. So like I said, the implant has kind of 3 parts to it. It has a reservoir. It has 2 cylinders that go into the penis itself and a little pump that's in the scrotum. The first thing is is that reservoir, which kind of goes up and over your pubic bone, kind of back by your bladder. Then you've got 2 cylinders that are in the penis itself, and those are the inflatable part, and a pump that's in the scrotum. The pump kind of goes between the 2 testicles. There isn't any removal of anything. It's got 2 parts to that pump. It's got a pump part, which takes fluid from the reservoir and puts it into those cylinders and gives you a firm, rigid erection. Then it stays there for as long as you want it to. So in 30 seconds, you've got an erection that lasts for as long as you want it to. When you're done using it, you basically push on the deflation button and normally squeeze on the penis itself, and that will take that fluid and put it back into the reservoir. Once you're fully healed, you've got kind of all the tools that you need in order for things to work. And one of the other things that guys like about it is that it normally lasts for 10 to 15 years or more. If we look at device numbers, 80% of devices are going to make it to 10 years. 70% are going to make it to 15 years. So in one surgery, you get a solution that lasts for a long period of time. It has no impact on the ability for you to achieve orgasm. It has no impact on your sensation. Obviously, it takes about a number of weeks, 3 or 4 weeks normally, to kind of heal and go through that healing process before you can start using it. And then after that, you can use it as often as you want to. From that standpoint, the satisfaction rates for partners and for patients are incredibly high because of the ability to kind of get a firm, solid, rigid erection. Hang on, I'm going to go over the slides. Right, like anything, there's risks of getting a penile prosthesis, and those risks are really low, but they're not zero. It's also a reason to see kind of a person who specializes and does a lot of these procedures. The first thing that we worry about the most about is getting an infection. It is an outpatient surgery. You go home the same day. It takes us about an hour to an hour and 15 minutes to do the surgery itself. There's about a 1 in 200 to 1 in 300 chance of getting an infection. So it's really low, but it's not zero. Sometimes we can treat that with just antibiotics, and oftentimes that's the case, but sometimes it does require us to take out that device. It's incredibly unlikely, but it does happen every once in a while. We basically do everything we can to prevent an infection. That includes giving you IV antibiotics. The device gets coated in a special antibiotics, and you go home on antibiotics to prevent that infection. Once you do a penile implant, other options like injections and things like that end up not being an option for you. And so, most guys, once they go to an implant, are never going to want to go back to getting an injection, obviously, because they've got a more reliable situation than they had before. But those options don't become available because of where we put the implant and what happens. There is the chance of getting an erosion, which is where part of the implant comes out through the skin or through the urethra, which is that P-tube. Those are unlikely in people who do a lot of these procedures, but it's not zero. Whenever you're putting an implantable device, there is obviously risks of it going, either the reservoir being in the wrong spot or causing issues or movement or things like that. Also chronic pain, and then at some point the device may stop working. Like I said, most devices are going to make it 10 to 15 years, which is what guys like the most about the implant itself. A lot of guys ask about insurance coverage. Most insurance plans, including Medicare, do cover the procedure, but we do all that work for you. You don't need to do that work. If your insurance does not cover it, there is an appeal process, and we do offer a cash pay implant price that does kind of include everything. So if your insurance for some reason did not cover it, there is a cash pay implant price. We can talk about that when we kind of get to that point. But for most people, there isn't an issue with insurance coverage. I tell all my patients to go get as much information as they can. This is obviously a sensitive part of your body, and we're learning about lots of things, including cardiovascular health and how to treat erections, which have impacts on you and your partner. And so you want to get as much information you can, and there's a whole lot of good information. And obviously go to websites that are trusted websites. There's a lot of bad information out there. Obviously, Google has done a good job with some things, but they can't take care of all websites that provide information that isn't good. These are really great websites that offer tons of information for patients to help kind of them make decisions and look at the different options. All right, we're going to kind of talk about a patient video here, and I'll mute myself.
Hi, my name is Stan Rydelic, and I'm 61 years old, and I live in South Carolina.
I'm Teresa Rydelic. I'm 60 years old, and I met this gentleman when I was 15 years old, and we've been together ever since.
I've been married to my wife, Teresa, we've been debating this, 39 years. 39 years. 39 years.
October.
39 years of bliss. About three and a half years ago, I ended up getting ill. I thought I had the flu. It turned out that I had complete liver failure, and so unfortunately, or fortunately, I had to have a liver transplant. As part of the procedure to nourish my liver, I found out what they did is they rerouted some of my blood flow and so I ended up with a condition called arterial insufficiency, which basically means that the lower part of my body had insufficient blood flow. After I had my liver transplant and I was feeling well again, and then I found out that things were not happening romantically. It was kind of a surprise. So what I did was I asked my general practitioner, and so he immediately says, well, you know what? All you need is some Viagra. So what he did was he gave me a prescription for Viagra. I went home. I remember that evening, I was thinking, oh, how wonderful, Viagra. Of course, it's going to be a great evening. So what I did is I put some music on, poured some wine for my wife, lit some candles, and guess what? Nothing happened. So I went back and, and every time we're going in, it's just like it's 2 weeks or so between, appointments, and it's still like nothing's happening. And you start to really get very discouraged. So the doctor gave me a choice. He says we could use vacuum erection devices, he says, or we can also use an injection. So I said, let's try the vacuum thing first. That was horrifying. Well, first of all, in my opinion, it was horrifying. It didn't really work. So that was like a one-time shot. And then we tried it was Trimix that I tried. And so I thought that was going to be great. Went home, and again, since there was a tiny bit of success, I thought this was going to be a great evening. So you try to get all romantic, and then you say, oh, excuse me, honey, I have to go into the bathroom and inject my penis with Trimix. I did everything that I could, and quite honestly, I had never even heard of a penile implant. And so this doctor I went to, he was a young gun, kind of like, cutting edge, and he says, I think the only thing that we could do, he says, to really guarantee that you can get an erection is a penile implant. So Teresa was a part of the process. She came to the doctor's office with me, and what we did is we had the discussion about it in penile implant, and she said, look, if it means that much to you, she goes, I want you back how you were. I want you happy. A couple things came up. The first one that I worried about was the procedure, a painful procedure. And quite honestly, I was told, and after experiencing it, it's an outpatient procedure. It takes less than an hour, in many cases a half an hour or less. Another thing that concerned me also, and this one's going to sound really, really very strange, but I really worried that I would have the desire to have sex.
Well, it's kind of ironic because that's exactly how I felt. I felt like, well, he's going to get this implant. We hadn't had sex in so long. Maybe that chapter's over. And I think that a lot of women worry that they're not going to be ready for this new adventure like they were. And it actually has been a renewal of our relationship in one area. And so I'm glad. I'm just glad it's freeing. It's taken on where we can be spontaneous, just so different than years before.
There was a romance.
Yeah.
There was a spark that was put back that we didn't know went out. The thing that's really, I think, been wonderful with an implant, with the implant, which I don't consider I have an implant anymore. It's just it's a part of me.
Right.
There's no. Well, first of all, from the standpoint, if you look at me, if you saw me in the shower or whatever, you cannot tell that I've had an implant at all. And then also from the other standpoint is you have complete spontaneity. There is never anything where you have to say, okay, you know what, I'm going to take a pill and wait a half an hour for it to happen. If you're in the mood, you're in the mood.
Right.
And it turns back the clock. I mean, I honestly feel like we're in our 20s or 30s.
Since the implant, there's a confidence there that is actually very sexy. And that confidence is something that I think the implant did for us. And I don't worry that it was me, that maybe I wasn't something that he was needing. No, we're perfect for one another, and now we have back our love life. If I could give some advice to someone dealing with this, a couple dealing with this, I would say talk to one another. Be honest and open and loving, because the answer may be no. The answer may be, no, I don't want to do this. And it may be, I've been thinking about this. So I think communication is the key.
If I could give a piece of advice to anyone suffering from erectile dysfunction, it is the fact that you have one life, and you have the choice to choose how you live your life and at what level of quality you live your life. So if you're suffering with something like erectile dysfunction, that's fine, you can live with it, but you don't have to. It's something that is so easily fixed, and you could have the quality back in your life that makes you a whole person again.
I couldn't agree more. I think that when I see patients both before and after implant who have looked at other therapies and made the decision, I think that the patients who undergo an implant are incredibly happy kind of with their decision, and are in all aspects, whether it's from what they talked about or other reasons, it really kind of helps provide another option for patients. We're going to kind of look and see if there's any questions that we have.